Good morning. I'm Brad DeLong. This this is my morning coffee. Healthcare costs keep rising in America. The total bill charged by insurers for employee and employer averages $12,100 for a family of four, twice the nominal level of 7 years ago, comfortably more than the full-time earnings of a minimum wage worker. An extraordinary explosion of health care costs for those of us Americans, 150 million of us in total, who get our health insurance through employer-sponsored coverage. On top of this come all the taxes for the government health programs. The total American health care bill is $7,600 per person per year right now, and rising rapidly. This matters a lot for American material welfare, for the American standard of living. But today I want to be more narrow, more sharp-penciled, to focus on what this means for American businesses. That is, businesses pay for health insurance coverage for more than 150 million non-elderly Americans. Businesses do this largely by historical accident. It's simply expected that the high-wage jobs that make use of the education, skills, and high-potential productivity of the American workforce, it's expected that those are going to come with benefits. And this creates a direct link between rising healthcare costs and slower economic growth. When health costs rise, the costs of employing workers in high-wage, high-benefit jobs rise as well. Businesses find they cannot afford to expand employment as rapidly and still maintain the past pace of real wage growth when they have to pay higher health insurance bills as well. Higher health costs make expanding through new hires very expensive unless businesses can cut back on wages. But when businesses offer lower wages, workers resist. The result is slow employment growth and higher unemployment until workers recognize the scarcity of good jobs and the higher risk of unemployment. That the scarcity of good jobs and the higher risk of unemployment teaches them they have little bargaining power, a process that takes years, if not longer. In the meanwhile, workers who ought to be in high-skill, high-wage, high-productivity jobs with benefits, well, they find themselves instead in low-skill, low-wage, low-productivity jobs without benefits. This is a waste. Workers who could be holding down and performing well at high-productivity jobs aren't, and so they don't get the wages they deserve. Firms that could be employing more high-skilled workers at high-productivity jobs don't, and so don't get the profits that they deserve, all because of this expected link between good jobs and benefits, and because of the rapid growth of healthcare costs. Now, successful economic growth in America. Successful economic growth requires a more efficient, lower-cost healthcare sector, given this link between health costs and business performance. And John McCain and Barack Obama proposed diametrically opposed plans for trying to get the healthcare system to where we all want it to be. John McCain proposes some call it a root canal, so dental surgery approach, without anesthetic. The problem, he and his healthcare advisors believe, is that good jobs are linked to healthcare benefits. Break that link, McCain says, remove the expectation that high productivity jobs come with benefits, and the healthcare sector will no longer be a major drag on the American economy as healthcare goes its own way, whatever that way might be. Hence, John McCain proposes, relative to the current system, to penalize employers that offer high-value employer-sponsored coverage and subsidize individuals who get health insurance outside the employment relationship. I see two big problems with the McCain approach, the journey and the destination. The problem with the journey is this. The McCain plan works in the long run by making employer-sponsored coverage more expensive in the short and the medium run. It thus attempts a cure by giving American businesses a much worse case of the rapidly rising health cost disease from which it currently suffers. Rapidly rising health costs are a drag on high-wage, high-profit, high-productivity employment now, There'll be a much worse drag on high-wage, high-profit, high-productivity employment under the McCain plan, because the McCain plan penalizes businesses that will offer high-cost health plans. The hope is that this shock will be enough to push businesses out of the business of providing employer-sponsored health coverage, and we will come out the other side and enter a better world in which it's no longer expected that high-productivity jobs come with benefits. But along the journey, there's a lot of pain. A lot of businesses that come under pressure to drop health care coverage, a lot of workers who find they're no longer being offered real wage increases because the real wage increases are being soaked up by tax penalties and respond by resisting. A lot of unpleasant and destructive churning in the market in the hopes that in the long run we get to a good place. But will we get to a good place even in the long run? There's a problem with the destination. The biggest problem in healthcare today is that insurers are rewarded. They're not rewarded for keeping their customers healthy. They're rewarded for figuring out which of their customers are likely to get sick and for figuring out how to pass the hot potato along to somebody else, how to push employees who might become sick and dump them onto other insurers or onto the government. At present, the magnitude of this adverse selection problem is restrained by the institution of employer-sponsored insurance. Bid for an employer's contract, and ERISA requires that you take any of their workers who want to purchase their plan. The destination of McCain's plan, it's a place where people aren't naturally found in large pools. It's a place where insurers have much more freedom to spend money, administrators' time, and computer power, separating the healthy sheep from the costly and sick goats. The profits to one insurer for doing this are potentially enormous, but the profits to one insurer for successfully gaming the adverse selection process, they're not savings for the system as a whole, they're costs for the system as a whole. The sick and the uncovered do show up at the emergency room eventually, and they are more expensive to treat when they get there, unless, of course, they die first. I think that when the McCain plan does move us to a world in which the expectational link between high productivity jobs and benefits is broken, we'll then have a system that works even less well, than our current one does. Barack Obama, by contrast, I think offers a sounder and more conservative approach to the problem of healthcare reform. Instead of using tax penalties and incentives to try to break the current system and build a whole new set of untried healthcare financing and insurance institutions, Barack Obama promises to build on those components of our current healthcare system that do work and to make them work better. But I've been talking for quite a while now, more than long enough. I'm Brad DeLong, and this has been